Good afternoon. This is Dr. Havens. This is our narration of Chapter 9, Organizations, Power, and Empowerment. The objectives for Chapter 9 are looking at the different types of healthcare organizations and how they differ. We're going to talk about the concepts of power and empowerment, and we are going to describe several ways in which nurses can be empowered as a profession. The nature of the organization that you work for has a big influence on your daily life as an employee. It's difficult to focus on the big picture, and some nurses prefer not to. I think most nurses actually think this is a great opportunity to care for the patients I love and make a difference and earn a good living. However, the nature of the type of organization that you're working for can have a big impact on your life. There are basically three different types of hospitals in the U.S. There are the private not-for-profit hospitals, which are usually founded and run either directly or indirectly by religious or charitable organizations such as Baptist Hospital, St. Luke's, and so on and so forth. So they need sufficient money to pay the staff and run the hospital, pay all the expenses, but they don't have to generate a profit in addition to meeting expenses because that is not their mission. The second type of hospital in the U.S. are the public government-operated healthcare organizations such as the VA. The old Alachua General Hospital here in Gainesville originally started out as a public community-run hospital. It was supported by the community, and as the years went by, the local community could no longer afford the hospital, so it was turned over to UF Shands, UF Healthcare, which is another government-run healthcare agency, and ultimately the university and Shands couldn't afford to run it, so it was closed. The third type of hospital, which is becoming more prevalent in the U.S., are the private for-profit hospital chains, such as HCA, Hospital Corporation of America, which runs North Florida Regional Hospital, and many others. The difference between these types of hospitals has become somewhat blurred in recent years for a couple of reasons. All hospitals and long-term care facilities have to compete for patients, especially with healthcare insurance or having to pay their own healthcare bills. All experience the effects of cost constraints. So this is why all hospitals and long-term care facilities have marketing departments now, and they're all competing to get the patients. 2/3 of U.S. hospitals are currently underwater, financially operating in the red. So they're all competing to get the patients to come and use their birthing center, their long-term care facility, their surgical suites, and so on and so forth, so that they can get the money and stay afloat. Also, all different types of hospitals now receive money. They're eligible for government reimbursing, particularly in the Medicare and the Medicare programs. And this is another huge payer source that they all want to get. Patient safety is a huge issue in healthcare organizations all across the country. Approximately 100,000 patients per year die as the result of medical error. So all healthcare facilities, especially the acute care hospitals, are committed to safe, consistent operations in the midst of a lot of high-risk activities. They want to maintain an environment where errors and what we call near misses are reported by staff without fear of punishment or reprimand, and this is called a culture of safety. They all use multidisciplinary and interprofessional collaboration to solve patient safety issues. This means that nursing works together with the pharmacy, works together with central supply and dietary and physical therapy and surgery and all of the other departments to make things safe and to provide good care. And they're all committed to providing whatever resources are necessary to address patient safety concerns. Other aspects of creating this culture of safety in our healthcare facilities is being vigilant about detecting error-prone situations and being openness to questioning the existing systems that we have and then changing them in order to prevent accidents or errors or injuries to patients. It can be very hard to change an organization's culture. Nurses who are working overtime or have heavy patient assignment loads or are fatigued are certainly more likely to be error prone and to make medical errors. So we know through a lot of recent research that increased workloads and also nurse stress have been found to increase errors and adverse events by as much as 28%. There are a lot of organizational factors that can contribute to an increase in errors or to also to providing patient safety. So what contributes to patient safety? A healthy work environment, which is supportive of the nurses, is one of the most essential factors in delivering high quality and safe patient care. Patients do a lot better in these environments. So collegial relations with physician, where there's a lot of respect for the nurses, a lot of skilled nurse managers in high-level leadership positions, a huge emphasis on staff development and training and also on quality care are important factors. Some of the factors that contribute to job satisfaction and low turnover among nursing management include a commitment to excellence, always striving for better patient care and refusing to accept mediocrity, meaningfulness, which is being clear about the purpose, the mission, and the vision of the hospital, whatever it may be, having regard for people to do the work and valuing those people, those employees and those workers, and also a culture of learning and growth, providing nurse mentors, a lot of guidance for new nurses, and lots of opportunities for growth and development so that you don't have stagnation. The culture of a healthcare organization is intangible. This means that you can't see it or touch it, but you will know if you violate one of its norms because you'll get some negative feedback from your supervisor or your coworkers. So how do you learn about the culture of an organization when you're applying for a new job? One thing that you can do is visit the website and read their mission, vision, and value statement and see if this rings true for you and if they're saying things that are consistent with your own worldview. So do they align with the things that are important to you and the way that you like to practice nursing? Can you see these values in action whenever you walk around the facility and look at how the nurses are doing things? Some organizations may not be consistent with your values or your worldview. For instance, some people are maybe a little bit anti-military, and if that's the case, they might not enjoy working, let's say, for the Veterans Administration because the VA is all about serving millions of people who served in the military. So other things to consider about the culture of an organization that you're thinking about joining might be the workload. Ask about nurses' participation in decision making and how well and how much of your input would be received by management. And look at what is nursing's role in ensuring patient safety and ways that you could learn from the nurses about how they do things to ensure high quality nursing care and patient safety. Does it matter what type of organization you work in? Absolutely, because there again, you want to make sure you're working for a healthcare facility that's consistent with your own values. Otherwise, it's going to be a struggle. So find out what the organization values, and then once you've grasped the kind of gotten a big picture of the overall culture, then you're ready to analyze it in a little more detail, particularly in relationship to its long and short-term goals, the structure of the organization, and the processes, which is how they do things. Sometimes it's very curious to discover where power comes from or how influence is used. Power is defined as the ability or the capacity to influence other people, whether they like it or not. So using power, one person or a group can impose its will on other people or groups. This could be positive or negative. An example of a positive use of power might be when a nurse manager gives a staff member an extra day off in exchange for working the weekend, or it could be negative, such as when a nurse gets moved to the midnight shift for having pointed out a physician error. The other section of this chapter is we're gonna look at empowerment. So empowerment is a feeling or a psychological state of competence, control, and entitlement. Power refers to ability, and empowerment refers more to feelings. Both are of importance to nurse leaders and managers. So what does feeling empowered mean? It means that you feel confident in your ability to do your work well. You feel that you have the freedom to decide how to do your work. You care about your work, you care about it, you take it seriously, you enjoy doing it, and you feel that people listen to your ideas, care about your ideas, and that you can make a difference. In addition to these three sources of power, nurses need to be able to access opportunities within the organization, such as the ability to move up the organizational ladder into management and get promotions. They need to be involved in decision making and other vital functions of the organization, and they need to have or be provided with opportunities to grow professionally. Without this, nurses cannot be empowered. Nurses who are contract employees, such as agency workers or temporary workers or part-time PRN, are less likely to feel empowered than the full-time permanent nurses who are more connected to the organization and more secure in their positions. However, managers and higher level healthcare administrators can and should take action to empower all nursing staff by providing opportunities. Probably some of the most desirable healthcare organizations in which to practice registered nursing are organizations that have what we call shared governance, where they have a nurse practice council that allows nurses to participate in decision making in the nursing department and all levels of hospital-wide councils: nursing professional development, quality, practice, and coordinating councils. We need to have a seat at the table in all of these. These councils can help set standards for staffing, career ladders and promotions, employee evaluations, diversity, patient safety, and so on and so forth. We need to be involved in all of this. This is how nursing grows and flourishes. I want to speak for just a moment about nursing professional organizations and their value, such as the American Nurses Association, of which the Florida Nurses Association is a state chapter. These allow for collective bargaining and also a collective voice that can be stronger than any one nurse's or a local group of nurses' voice individually. By joining together, we can make our viewpoint known as nurses and our value recognized more widely. There is strength in numbers. We can go before the legislature and we can try to get laws passed that are more favorable to nursing practice. Through our professional organizations, we can have a louder voice. Our organizations can speak to other groups of lawmakers and policymakers. They can write letters on our behalf, and they can change policies and procedures more widely than we can on our own. So it's good to be a part of a professional nursing association. And this concludes Chapter 9. I apologize again for all the pauses and clicks. I'm having mouse problems this afternoon. Technology works great, except when it doesn't. So thanks for sticking with me and making it through this chapter.